We even talk about that. You've mentioned about the vaccine.
Yes.
Is it available?
So yes, okay, it's coined from the same, it's coined from vaccinia virus. There's, in that group of orthopox viruses, there's one called vaccinia, which is now what was used to, you know, vaccines are formulated from something. So they are formulated from an attenuation means a virus that has been modified somehow. A virus that has been modified to remove the infectious part so that it can help the body gain an immunity against a disease, but it will not infect that person.
Okay.
So the same vaccinia virus that helped eliminate smallpox in the world, which actually saved many people in the early 20th century. So the same vaccine is what is somehow being modified now to also fight Mpox. Okay, so there are some countries which had banks of these vaccines. Of course, they are Western world. Some countries had the banks of the vaccines already, and now because science is always evolving and the side effects of that vaccine were known, they can try and maybe modify or not modify what is available already against smallpox and now use it against Mpox. But the same vaccine for smallpox can also work against Mpox.
Okay.
So now people shouldn't fear because again we
are fearing.
No. We've seen our grandparents. Some have lived over 100 years.
Yeah.
They've delivered very many children. So of course the vaccine did not affect their fertility.
Yes.
It's not a new vaccine in the world.
It's not.
So fertility is guaranteed.
Hiyo ni muhimu.
Long life is guaranteed.
Yeah.
The same, it was smallpox vaccine was also being administered on pregnant women, and it was being administered on babies.
Okay.
It was part of the routine vaccinations for babies, and they survived that long. So people should not fear vaccinations if it comes to that point. Yes.
And that you're coming from Sondral Medical Center, right,
Yes.
in Muthaiga. Have you received the vaccine so far?
No.
Do you have people interested in taking it before things go haywire?
No, I think for interest,
yes,
because of what happened with COVID, people have this sort of vaccine apathy, and I don't know why.
But for COVID,
before I came, there was, and I hope he's watching me because he told me he'll come and debate me. He said his grandfather has been well, so healthy, but after getting the COVID vaccine at 85 years, he developed a rare disease called bullous pemphigoid. Okay, bullous pemphigoid, it's a disease that forms blisters on the skin. It's an autoimmune disease. Oh, no. And they are blaming this bullous pemphigoid on this vaccine. But I told him it's not a rare disease. You know, some of these diseases, people think they are rare, but they're not rare. They were just not diagnosed because you never saw a specialist. So as to say, even at my position, to say that I've seen something quite unique because of COVID vaccine, I would be lying.
Niwongo.
No, I haven't seen any. And I think in my field, we see a lot of rare diseases. So, and you know, the skin gets a lot of attention. So someone will be like, I've gotten a rash because I got a COVID vaccine. But when they come to you, you'll be like, this is not even a rare rash. These are things we were seeing before COVID vaccination. So I'm not trying to say that that vaccines don't have side effects, but especially for Mpox, I really want to dispel that fear, and that's why I came here. No one has paid me. I don't work for the Ministry of Health. I work for Kiambu County government in my own practice. I don't want people to get this notion that all vaccines are bad, especially for this one where we've seen them surviving. Some of them are alive with that mark for smallpox vaccination. It's not really something that people should fear, honestly.
Okay.
Yes.
So ziko almost the same.
Almost the same.
No problem. Zikikuja, I'll be the first one. I'll try it. You know,
some people have their bank already, so they've started. Yeah. So
in Kenya,
because even after a disease has been eradicated, there are some countries that will reserve banks, and there are some people who will get contracts to now produce this vaccine. So Kenya is supposed to get 50,000 doses. Alone. And I think so far, 10,000. No, you know, this is the initial phase, because I think they were sending 200,000 vaccines in Africa, these 4 countries, in this Rwanda, Burundi, Kenya, and I think DRC.
Yeah.
So the countries, they've been allocated a certain number of vaccines. The country has to decide who they are going to prioritize amongst their risk groups.
How will they decide that?
So because, okay, so for instance,
Yes.
as I said, it's a mucosal disease as well. It's seen in the mouth, anus, in the penis, vulva.
Yeah.
So for some countries, the one priority in the US, the Western world, one priority group is the men who have sex with men. Because if they get similar ulcers, someone might think it's an STI, kumbe it's an Mpox infection. And they've particularly been seen to be affected more. I think because of this transmission through mucosal surfaces. Might not be the case here. So here, obviously, we are seeing more infections in the truck drivers. The other special group that would get priority in Kenya would be the people testing the samples and healthcare workers. And then as more vaccines come in, because these are things that cost money, they are being distributed by WHO, CDC. So as more vaccines come in, they open up the number of people who are eligible to get these vaccines.
So is it free to get it right now?
Yes, it is free. When it's coming through special programs, it's a free vaccine. Even treatment is free.
Even treatment? Oh, that's a good one.
Yes.
Okay, that makes sense. And as you're saying about STI, you can, it is being misdiagnosed.
Yes, you can confuse them.
And if you treat it as STI, does it go away?
No.
Okay.
No.
So itakuwa tu hapo bado.
It will just be because STDs, they heal faster. So if you're diagnosed with an STD, you're forming ulcers because of an STD, in 1 week to maximum 2 weeks, you will have healed. But this is a disease that evolves over a long period of time. So Mpox will take 2 weeks plus to heal completely.
Okay. And as you're talking about the vaccinations, I know we are just taking a short commercial break. We come and talk about myths and misconceptions about now this virus actually.
Okay.
And so guys, don't go too far. We are coming back shortly, and then we're going to know about the myths that are there, and she's going to dispel all of them and just give an easy treatment. At least Kenya, let's keep calm because clearly we are not quite at risk. There's a solution to it. So don't go too far. This is Health and Wellness. Unakaa hau alafu unajua wanaweza ona kama Welcome back. If you're just joining us, remember this is Health and Wellness. My name is Zaitun Ali and I'm still joined by our dermatologist, Dr. Carol Mwatha. Karibu sana to the show.
Asante.
And the topic of discussion has been Mpox in Kenya. So we've known how it is being transmitted, how to diagnose it, and clearly there's a vaccine that is out. So kuna hopes watu. This is not going to be a pandemic like COVID. And remember, if you have questions for us, 0759-434389 is our WhatsApp line. Also find us on our Instagram at KTN Home _ and at Ali _ Zaitun. So, Daktari, before the break, we were just talking about what Mpox really is, and we've established it. But coming now to the treatment, the vaccine, someone is asking, how is the vaccine administered? Is it painful? How do you do it? Is it just a syringe? By the way, wakumkelea COVID ulikuwa unaingisha sijui nini huko ndani. Yes. So people are asking, how do we test it? How do we vaccinate it?
Vaccination, the guideline has not yet. The vaccines have just arrived in Kenya, so we have to wait for the guideline on how to do it. But it's normally an injection on the upper arm.
Upper arm.
Yes.
Okay. Sawa, hiyo ni rahisi at least. But after now getting Mpox, mbona atakuita smallpox, Mpox, there's post-exposure prophylaxis. Talk about this.
So post-exposure prophylaxis would be in the scenario that someone has already been exposed.
Yes.
Exposed to either someone who has been diagnosed with Mpox or someone who was suspected of having Mpox.
Yeah.
So first of all, this person needs to self-isolate, okay? They need to self-isolate during the incubation period, which is up to 20 days. So on the 3rd week, if they've not shown any symptoms, they can go back to life as normal.
Yeah.
Vaccines, as they are coming in, because it's just the first batch, I think, which has arrived in Kenya, which of course is going to be distributed first to the priority people, like the people testing the samples before the government decides who else to prioritize. Of course, when the vaccine comes in, that is the best method of post-exposure prophylaxis, that you get vaccinated as soon as possible, and then you continue self-isolating away from other people, and you wear long-sleeved clothes. Don't come into close contact with people. Just stay in the room and don't go to work, or if it's a child, not to go to school for this 3-week period.
Okay. So this one is 3 weeks thereabout.
3 weeks, yes.
Okay. So another question also we have is, can it be sexually transmitted?
Yes. Contact.
Any kind.
Yes. So it also manifests in the mucosa. That's the mouth, vulva, penis, anus. So yes, it can be sexually transmitted.
Oh,
and in
Lord.
some countries, they are considered a special group as well. Like sexual workers, they are considered a special group in those countries.
So they're given the vaccine.
So they're given the vaccine in priority.
Yeah.
At some point, if it continues being a pandemic, everyone will need to be vaccinated. It might even be incorporated into the childhood vaccines. It might be incorporated into the childhood
like
vaccines.
the measles,
yes,
blah, blah,
if
blah.
it continues being a pandemic in the world.
Actually, it should be.
Of course, when
iliekwa?
Smallpox.
No.
Smallpox used to be a childhood vaccine.
And then what happened?
It was eradicated in the 70s. So no more. There was no more smallpox vaccination, I think, after 1980 in the whole world. So.
And these measles, the way wamedungwa for so long, by the way, has it ever been a threat?
Okay, you know, these diseases, even for Mpox, they are a threat in some groups of people. So immune suppressed people, like HIV positive, children are considered immune suppressed. Pregnant women are considered people with a lower immunity. Again, here we have malnutrition already, so those ones are considered people with low immunity. The problem is when it's on the skin, containing it is a bit easier. It can spread. It can infect the eyes. It can infect the conjunctiva and form ulcers, which will of course lead to blindness, which is irreversible. It can affect the lungs, causing a pneumonia, a very severe type of pneumonia. It can infect even the gut, causing gastroenteritis, very bad diarrhea, profuse. It can infect the brain. So once it infects other organs, it's almost fatal.
Actually, it leads even to another question that someone asked. Is it a death sentence?
it's in a healthy adult. In a healthy adult, it's self-limiting more often than not.
Okay.
But in immune-compromised adults, in people who don't have a good nutrition, in children, it can lead to severe symptoms. Yes, it can lead to severe symptoms, which will lead to death.
Okay.
And the medication, even if it is there, it's still ongoing research. We do have some antiviral agents, tecovirimat, cidofovir, which we don't even have in Kenya currently.
Oh, no.
Only if you have, like, say, a patient who's complicating, then you can apply as a hospital to get the medication to be brought in by WHO, and then it's prescribed to the patient. So as it is, the medication is not that readily available. And by the time you need this medication, it's quite severe. It can actually lead to death. Yes.
Okay, and as a dermatologist, how are now people treating it, especially the
open sores?
Yes, the open sores
So
on the skin.
yeah, so this person needs to quarantine. Okay, you know, our healthcare setup is not like the Western world. We have to consider that we might not have the resources they have, that they can isolate all people who are infected and take care of them themselves. Here, if we try to do that, we will really minimize healthcare staff available to other patients as well. So these are patients who are mostly affected on the skin and the mucosa, the vulva, penis, eyes. So we can help guide them on how to take care of themselves at home. So as I said, admission can be done in preparation of guidance on self-isolation and self-care at home. Antiseptic washes, which the dilution of which should be guided by a healthcare professional. Paracetamol and other painkillers. It's not severely painful, but it is still uncomfortable, and there's fever. So we can give paracetamol, we can give analgesics.
So just like normal fever, you're
Yes,
treating it as normal fever.
And then taking care of the skin so that it doesn't get infected. Antibiotics only if there's proven bacterial infection.
Yeah.
Calamine lotion. There are ways of
that
controlling
one for chicken pox.
Yes.
So it's the same.
Yes.
Alafu hiyo ndo inakausha the open sores, and
yes, inaweza kausha the open sores, and
Yeah.
then for good skin healing, good emollient application, if some of them form pus, you can give topical antibiotics. All that care can be done at home through the help of community healthcare workers and visits by healthcare professionals, rather than bringing them into hospital, especially when it continues spreading rapidly, and keeping them there for a long period of time. So for now, we can still afford to isolate the cases that have been confirmed in hospital, but it might not be practical in the long term. And in case it needs to be, if one of your relatives or yourself or someone you live with at home has been diagnosed to have Mpox, and the suggestion is to isolate them at home, you shouldn't be afraid. They can even be passing a plate or through the door or a window, because as I said, close contact is what causes spread of the infection, not distant contact. So they can learn to take care of themselves, clean their own clothes, clean their own environment, clean their own utensils. Just like the people isolating themselves during COVID away from people, it is the way we will end up going if it continues.
And just like chicken pox, it can occur to you more than once.
Yes.
So can Mpox occur more than once?
So extrapolating from the similar disease, smallpox, generally, once you've gotten natural infection, once you've been infected, so there you can be infected, in quotes, by the vaccine. Like the vaccine, you're administered the vaccine, and then your own body forms immunity against Mpox, or you can be infected naturally by Mpox. You more often than not get immunity against it. The problem with Mpox is we don't know that acquired immunity after infection, how long it lasts. Because as I say, this is a disease that was largely ignored. It was there in the Central African countries and Western African countries, but it was largely ignored.
Who should we blame?
Well, even us, we ignored it because we didn't have it in Kenya. So we ignored it. So the ones who have been having it, they have known. the natural evolution of the disease
Yeah.
and infection. Though I have heard of some cases of the men who have sex with men still getting infected by Mpox even after getting another infection, which again, it's not proven by research, because the same ulcers could be ulcers because of another disease. So it's not proven by research, but by and large, once infected by Mpox, you form a natural immunity against it,
Yes.
but we don't know for how long.
Okay.
So now that it is happening now and it has gotten attention, we will know for how long this natural immunity lasts.
Sasa lazima wenye wameshikwa nao ndio wakue experiments, you know?
Yes, so
And
exactly.
then
So
we
they're
learn
the ones
from
who are
them.
going to be followed
Oh,
up
no.
to see if they've gotten immunity for life against Mpox. But you know, even in varicella,
Yeah.
varicella is chicken pox. You don't
Oh,
get,
yes.
you get immunity, but even when your own immune system gets compromised, like if
Yeah.
you get HIV, if you get diabetes, and then your immunity is challenged, it can reappear.
True.
It can reappear as now a disease which we call herpes zoster, where a person gets the same vesicles for chicken pox, but on one part of the skin. Very painful and
Really?
yes, so it can reappear in cases of low immunity.
Actually, my son got it twice. Yeah, kwanza akiwa, I think 2 years. Then the next one he got when he was like 3.
So he's a child. So children below 5, we consider them to have low immunity. So it can happen.
So
It
anaweza
can happen.
shapita 5. So below 5 they can get
They
more than
can
once.
get it. And even adults who, again, they
Yeah.
got an infection in childhood of chicken pox, and then the immunity, because of some reason, either nutrition.
Yeah.
I've seen quite a big group of men who like eating in hotels, not well nourished, getting zoster. Zoster infections, stress can lead to zoster infections.
What?
So even Mpox, it can be the same thing. Once you get infected, you get immunity towards it until another challenge of your immunity happens in later on, like you get HIV, your nutrition is not so good, you get diabetes, then it can recur.
Okay.
So we don't know yet. We are going to follow this group of people who have gotten the disease
Sadly.
and see how it evolves with time.
You've mentioned about nutrition for quite a while. So how does it affect probably
The outcome.
Yeah, the outcome.
So
And even how can we ensure we are having good nutrition to just prevent this Mpox?
okay, so diseases, nutrition is a very big factor in disease, and I'll talk about my field because I'm a dermatologist.
Please do.
The skin carries protein. It's actually the organ of the body that carries massive protein in the body and fluid. So in any disease that affects the skin,
Yeah.
even simple, not simple, so okay, simple to me, but even eczema. If a disease affects the skin and affects the skin in a big percentage, so it affects the skin in a big percentage, it means this person is losing a lot of protein and is losing a lot of fluid. So even in smallpox, in chicken pox, especially adult chicken pox, and in this case, even in Mpox, exfoliation of the disease is something we should factor at home. So as we manage these patients, we normally recommend for a high protein diet.
Okay.
A high protein diet can be achieved expensively and cheaply.
Yeah.
So at home, cheaply is milk, like we normally advise, instead of taking water and you're trying to overcome a disease that is affecting the skin, take milk. Okay. So more of milk, less of water, eggs. And I know this is going to be a debate because many people, when they come to dermatologists with anything on the skin, even chicken pox, they'll say
milk. Even eczema.
it's an allergy to eggs.
Hata eczema, unashanga, unaambiwa punguza protein. So now, where's the discrepancy?
Please, if any doctor tells you to punguza protein and they've not tested you for an allergy, that's not a good thing, because we actually need that protein for your skin to heal. So even in the case of Mpox, they should be on a high protein diet.
Oh, wow.
Eggs, they should take eggs unless you have a clear allergy to eggs. They should take beans, soups, meats, milk, and then of course they are added government distributed and even therapeutic protein foods which you can be given, therapeutic biscuits and such.
Oh, kuna kuanga na
Fluid,
hizo?
ziko.
Hizo ndio gani hatujasikia? Ati
For the
therapeutic
ones,
what?
biscuits. They're therapeutic
Hiyo unapewa ukiwa na
biscuit.
shida gani?
Protein, they're still from protein.
Okay.
Plumpy
Really?
nuts, there are some things
Ah.
called plumpy nuts, quite common, distributed for free by the government.
Yeah.
So a high protein diet is vital for skin healing. Okay. The other one is fluid intake, because again there's a lot of loss of fluid, and if the skin is affected and it loses a lot of fluid, the kidney will be injured, because the kidney needs fluid
Yeah.
to filter. It needs water in the body to pass through it to be filtered off toxins. So if the kidney does not get enough fluid, it will stop functioning. So at home,
Yeah.
the person self-isolating should stay in a warm room, because the skin is the cloth of the body.
Yeah.
Should stay in a warm room, should be on a high protein diet, should be taking a lot of fluids, and then these other things: antiseptic baths, coating the skin with something.
Antiseptic. To which level of antiseptic? Yeah.
I would prefer you're guided by a healthcare professional. We will
Exactly.
look at the affordability, what you can
Actually,
afford.
No, actually, what is harsh and what is not harsh?
So most
especially for the open
antiseptics need to
sores.
be diluted. For open sores, they need to be diluted. It can be
Hey.
Dettol, Savlon. There's a way we dilute it, and
Okay.
you'll be guided by a healthcare professional.
Okay.
Those might not be the most affordable options, Savlons and Dettols. For people,
Aloe vera.
yeah, they might not be the most affordable options. We do have other affordable options,
Which
like chlorhexidine, Hibitin. It's commonly used in maternity wards. It can be an affordable option, and more available, and because it's sold in jerry cans, so the person can just be given a whole jerry can and taught how to dilute. Unlike these bottles of Dettol
Yeah,
and Savlons that
small.
they are not bad, they might just not be affordable for everyone.
Okay.
Yeah, and of course coating the skin with something, whether it's calamine or an emollient, based on how the skin lesions look like.
So does it need to be moisturized, the skin?
Yes, of course, because
the
how
time.
you will not heal well if you don't moisturize. The skin will need to be covered with something.
Kaina kuoga.
Si unaoga mwenyewe, you shower by yourself.
Yes.
Because we are trying to, you have to make solutions that are practical.
True.
If you're functioning well, you're walking, it's the disease is on the skin. You can bathe yourself. So that you don't expose someone else.
Okay.
No, it's not that painful. No,
Okay.
you don't scrub. You just, there's a way to do it.
Okay. So watakuja uambie. Please tell them where to find you, because we are grateful for at least we know the do's and the don'ts, how to prevent ourselves from getting it. Vaccine ikikam, please tupigie. Tukiwe wa kwanza. You're saying 50,000 coming to Kenya, please.
No, they'll come.
They'll come more.
More and more and
Yeah,
more and more.
but utatuambia tukuje Kiambu County, yes? So just tell them where to find you at least.
Okay, so
This is your camera.
okay.
Yeah.
I'm Dr. Carol Mwatha. Currently, I'm stationed in Kiambu County, and I also have a practice where I go to called Sonrol Medical Center in Muthaiga. We have actually been seeing a lot of cases turning out to be chickenpox. I think since this
Wango.
Mpox came, so many people are coming to hospital, which is a good thing. Which is a good thing, because everyone is now scared. What is this on my skin? What is this on my skin?
But ni chicken pox.
Chickenpox, scabies, some are just
Ati rabies.
scabies.
Oh,
Scabies.
Sorry.
Yes.
Okay, sawa. So they can find you there. Thank you so much for coming and sharing this. In case you have any other questions about Mpox and you'd like to reach out to Dr. Carol, just WhatsApp our line 0759434389. But at least today we've had insightful information about it. We are no longer scared. Thank you for demystifying all the myths and misconceptions. So guys, this episode will be uploaded on YouTube just immediately at KTN Home. Find us also on our socials at KTN Home _ and at Ali _ Zaitun. So until next time, thank you so much for tuning in. This has been Health and Wellness.